Good morning, good evening, good afternoon, everyone. We welcome you all to another episode. With us today, we have Dr. Amoghsiddhi, who has been working as a family physician, a clinical in charge by Atashri, which is one of the pioneer institutes to start elder care in India. Today, this organization is working in India for decades, and there's a huge learning curve. And we would love to know more from Dr. Amoghsiddhi's experience of is organized, how things happen. Because, like we were talking before, there is no niche population that it serves to. So I will also welcome today on the show my favorite host, Pankaj. And my co-host Pankaj is a backbone that actually inspires us all to continue. So, baton back to Mr. Pankaj.
Thank you, Dr. Mrigna, and thank you, Dr. Amok, to come on the show. Let me introduce Dr. Amoghsiddhi. He's heading the vertical of care homes, the geriatric centers of the ASEAN, of the Atashri group, which are who are the pioneers of senior living in the country. Uh, they actually set the ball rolling when it came to elderly care, and I think a lot of people from the sector and the industry have always looked up to Mr. Shashank Pranjpe and his vision about the senior care roadmap, and he has been a driving force in the country, I would say. Though they are strict, primarily right now based in Pune, they have a project in Bangalore, they have a project in Baroda, and if I'm not mistaken, they also had a project in Australia. So yes, the group is very strong in terms of their ethos and ethics when it comes to the caring for seniors, and probably this is a subject which is very close to the family's heart, and that is why I think we see the kind of quality and the kind of level of commitment from there. So welcome, Dr. Amoghsiddhi. It's a pleasure to have you, and we really look forward to a lot of learning from your organization's perspective and from your perspective.
Thank you. I am looking forward to discuss a lot of issues and learn new things, understand new things, and understand different. Happy to be here.
So, Dr. Amoghsiddhi, since you have been a part of the medical team and, of course, heading the geriatric care department, I would ask you the simplest question that I ask all my guests, especially who are in geriatric care or assisted living kind of setup. So, how well you think we are equipped, as a country, as a nation, to handle geriatric care, especially the assisted living facilities in India? How well you think we are equipped?
So, initially, I would go on to explain and to make people understand on what verticals the elderly care definitely depends on. So, there are
Mhm.
five things which be any there might be smaller things, but what is at the top of the vertical is the infrastructure and the management part. So infrastructure and management and the administration works on the top works, and on the ground we have clinical, social, and nursing care. So these are the things that geriatric care, elderly care, or any care related institution works on. So these five verticals are so in the administrative part, we have different posts, we have infrastructure, we have like, for example, we have infrastructure which is not exactly developed for the elderly care or for taking care of these geriatric residents. In most of the places, uh, I will not see that these places are built according to the residents are needed or the care that is needed. So these are converted into these geriatric homes. So now, uh, in the last 4 or 5 years, I have seen the change. The change is that the institutions are being built according to what is needed, according to uh, what is necessary to cater to these patients. So, for example, initially there were those or any other buildings, those were converted to an elderly care center. So now the institutions are aware that whatever is necessary for the residents, whatever is necessary for the according to some guidelines probably, or according to certain research that is happening all over the world, we are now trying to imbibe into our system and build newer institutions which are catering to these things where somewhere where the place was ideal in the department. Now it is built according to how close the rooms are. It is built as a center hub. So the nursing stations are built like way. Uh, for example, there are other things like uh, access to the toilets, access to different activity rooms, access to different floors, different accessibility in a different way. So now the base infrastructure is built that way that we are equipped to cater to the residents. Other thing that I want to do is that I want to say is that the administrative part. Before administrators used to be working as just like a hospital. So administration was taken into consideration like a hospital. Now they have come a step down a certain way and understood the fact that these are not hospitals. These are somewhere in between a hospital and a home. So even the people who are managing and working with the administration have understood that the closer they look to a home, or the closer or uh, the more relatable scenario is if in a hospital you will have a bed, in an old age home also you will have a bed, but in that room in a hospital you will not have things closer to the person emotionally. But in a care home you will have everything that is catering to the person's emotions, like uh, whatever the patient needs, whatever the patient has in daily life, you bring it closer to the person. I know it is not an equivalent to a house, but definitely somewhere in between. So now we are trying to get to that point where we understand the Indian society, understand the elderly, and getting close to whatever is uh, rather than being the standard, whatever is necessary for the patient's emotions and his dependency. Uh, the clinical part has become more complex. So initially it was just like taking care of uh, the people, taking care, just helping them or assisting them. So now the clinical part, medical gadgets or care is available even in remote places now. So after COVID-19 pandemic, everything is available and people can set even ICU like setups at home. So now clinical work is even more difficult. People are more well read on Google, or from maybe even trusted sources are easily available. So with all that knowledge and everything, clinical part has become a little bit more difficult. So rather than calling them patients, I make sure that everybody is called a resident because they are staying there and making sure that they feel less of a patient and more like member of the family, more like a person staying there, enjoying and living there. So it is a more complex job for the clinical team now. Nursing and social part is what we have right from the beginning. So the social part, as in different activities, making them useful for all that. Uh, Making use of different things, celebrating festivals, taking regular exercises, caring for the patient, taking care of the patient's body, mind, soul, whatever the different aspects of the life are, spiritual part, spiritual care. So all of these parts need to be catered to. But uh, in India, we still have people available for care. Hence, if you consider the advanced equipments, if you are considering mechanical equipments, then India is still working towards it. So it is not easy to equip the assisted living facilities with all the gadgets, but we are working we are working that we make these advancements possible and reduce errors, reduce any of the fears, like there are fears of fall, transfer, and all those equipments. So we'll be soon moving towards them. So once we find out a solution for all, once we settle down with all the five aspects first, the human aspects first, then we try to mechanize it. But still, we have a lot of people available for care. We have, uh, like, we are, in fact, we are trying to keep the emotion and human touch alive with that. So on a scale, we are moving towards being better equipped, but still there are certain places which are still working on a traditional and with the traditional ways, they still need to work little bit on the care part.
No, I think great.
Right.
Yeah, when you said about this infrastructure part, the first thing which came to my mind was a lot of these care homes in Gurgaon, at least I am aware of, they were actually being
Mm.
run as OYO hotels or guest houses. So
Yes.
that was the nearest one could when one could find a property to run a senior living center. No, no, no offense, Mrigna. I understand where we are
Not,
taken, but
none taken.
but yes, a couple of centers because I personally am aware of it when the lease deed was signed and things like that. So but that was the only option available. And
Yes,
to make
exactly.
a
So
small project of let's say 15, 20 rooms and for someone to invest, you had to have deep pockets because the business model is still growing and people are not very sure that they should put in that kind of resources and how long it will last. So probably that was the best thing to do was to take up a facility which was being run as a guest house or as a kind of a better hotel in a way I would say, and convert it into a senior living care home facility. So I think that is something which she's saying is right that people are now moving in. A lot of groups are coming into as a branded the geriatric care centers. So that's very good. So, Dr. Amol, I would like to just ask one thing. So typically, what is the duration of a stay of a resident who comes into your place? Because when we talk of independent living, it is obviously more of a housing setup,
hmm,
and when we talk of
hmm.
a nursing thing, it is definitely a little much more higher care end. But when it comes to care for a geriatric care center, number one, what are the kind of level of services do we provide? And secondly, what is the typical age group when people come in or in what condition and how long generally do they stay?
So uh, there are stays which are ranging from ultra short stays, like around a month, to lifelong stays. So whatever life is still permits them, so they stay till the end. And see, what happens is there are. That's why initially said that there's no niche we can just put everybody under. So what people try to do is call them elderly. So we call them elderly, but you cannot place a 60-year-old and a 90-year-old in the same space. You can also not hold one 90-year-old and another 90-year-old in the same space. So that is a very difficult part for us. What we do is we try to categorize people on the basis of comorbidities, on type of stay, and what is the main concern of the patient or the resident. So what if there is a certain 85-year-old who is walking around, who is doing everything else, but just had a femur fracture. So he or she might come just for the rehab period. So they'll come for 2 months, they'll stay with us, have a nursing care, have physiotherapy, rigorous targeted physiotherapy, and go back home. Sometimes what happens is a young patient, multiple comorbidities, probably cancer, end-stage renal disease, heart patient, then we care for them throughout their life. So till the end, we can care, end of life care, palliative care, whatever is there, we can take care of them. So it is very difficult to characterize average length of stay of the patients, but probably everybody on an average comes after the age of 75, and there are patients who are around 100 years old also. So they come, many of the patients before what there was quite a taboo to come to an assisted living facility, but now people are shifting on their own will. Like I just want to stay there, have a nice stay, and continue living there without being a burden on any of my children, any of my relatives. So now whatever you see, like there was quite an image, quite a label on all of these facilities. So since I've been working, I am probably advocating more in the positive way because I think like if we are allowing, for that matter, a 1.5-year-old child to go to a kindergarten and playing amongst people, amongst children of his or her age, then probably a 75-year-old needs the same.
Very true. 100% agree with
I
you.
think, Dr. Amoka, that's a very good perspective, Pankaj, isn't it? To have a look and think about it from that perspective of, that we everybody needs to be with their peers. That's true.
Yes.
Very
So
well.
and if you read, if you Google sometimes, there are 3 Ds of elderly population. So it's delirium, dementia, and depression. So
Yes.
probably I'm not saying that this will stop the delirium or dementia or the depression. Nobody can replace your spouse or your children or anybody for that matter, your close relatives, but definitely you can try. Definitely you can have a go at all these places and find a different perspective to life because many of the residents that initially were homesick or initially were not willing to come or not willing to take part in all of the activities later suddenly be an active member of all these activities, social activities like singing or whatever. And then you will find that so many dreams, so many passions were killed, so many passions were at fault due to so many responsibilities at young age. And there's so many things that are missed due to labels that you cannot do or you can do or you have to do a certain things certain way or you have learned this, you are educated in this, so you have to work in this field. So you'll understand a lot of things, you'll understand life, and every day is a learning experience for me uh, clinically also and also socially. So I am typically a different person every year. Probably I learn something new, something
That's very
like
encouraging.
there's a
That's
food for food for thought, food for my soul kind of thing.
excellent. Excellent.
I think working in the elder care sector, this is what even I have learned for the time that I have worked here is that there is a lot of you take a lot of things back with you. It's not like your typical job that you go, you work, you come back 9 to 5, and the life is over. It's more like you bring something from the work to your heart, to your mental space, which I feel is sometimes challenging, but sometimes it's very rewarding also in that term. So, my question to you would be, Amaga, we were talking about hospital, that there were earlier concept of hospital or nursing homes, and then there came, senior residence places, which started like residential places, and now we have something in the middle, which is
Hmm.
like an beautiful thing between a hospital, it's not a hospital, and something between your residences, your homes. So, was on the other side, it does have all the necessary, needful, hospital facilities or medical needs to be fulfilled of the individuals. We are saying that. So, this brings me to a very interesting question that we have hospital management in India, we have hotel management in India, We have so many managements, running about courses, but we have
Hmm.
nothing like assisted living management in that case, right? Or a residential facility management for that case,
Hmm.
which I feel is a need of the hour. Little by little, as the industries will grow, things will grow. We would need probably doctors, and other people to do these courses, because I have seen, honestly, in my experience, uh, people from very good medical background like yourself, working in such places and bringing the best out of it, and people who are probably nurses, good nurses, holding this place. But I don't you feel that there is a challenge here for the shortage of the trained geriatric professionals in India? What do you think about it?
I think this is a definitely good topic to discuss, but I'll give you a general view of everything that happens in India or all around the world, probably more in
Mhm.
India. Nobody uh, will be interested in it. Few of the people even will mock you till you get to the reward part. So you'll see a lot of memes online where the support, you'll see nobody to support you and to congratulate a stadium's photo will be there. So that kind of thing happens with everything. So if you, in a general perspective, if you see that the stocks you back, but people have started investing now. So it must be around 40 years later, they have started to invest physically and monetarily because they know that these things are giving proper rewards. So I think geriatric care will also be that way. And I think after 15, 20 years, the population is expected to triple in India because the if you have the highest 50, 60, you'll have the highest amount of elderly population. This is, I don't think this is statistical knowledge. This should be a common sense. So at that point, everybody, once you start getting the rewards, everybody will be diving into this field. But working at this moment will be definitely difficult. Explaining the importance of geriatric care, explaining uh, how to manage a patient, a resident, staff, facility would be necessary at this moment. Then only we can cater to this problem better 30 years from now. So I think there will be a course which will teach you, which will teach people about geriatric care, and I think some of you will be definitely guiding the people who are really interested. So this is I think the driving force for anything, for running anything or making people interested is uh, unfortunately or fortunately money. So that is going to be the case. So it is difficult to gauge and difficult to tell everyone that this is the awareness we need. This is the thing we need. This is what is going to happen after 30 years, and that's why we have to start today. This is the infrastructure. Everybody is going to ask you on what on paper that how you are judging it, how you wish, like how you are trying to analyze it, and it is difficult to tell at the moment that what amount of care and amount of infrastructure is needed at that point. But you can always speculate, uh, and I'm hoping that such a course will come and all of us can support it. All of us can be a part of it and help the newer generation to take care of the elderly at that moment and probably in some years take care of us.
Yes, I think that is something which is very important. So just to take a cue from this, typically, what is the level of education background what these caregivers have in your learnings? How well educated are they?
So, so most of them are they have passed the 12th standard and working or studying nursing care. Some of them are general duty assistants and they are quite well trained. They're quite well trained to handle patients, understand their needs, And due to the newer part of education, some of them also are interested in nursing. So they are more curious about uh, all the aspects of clinical care. Like initially, some years ago, the attendant was not very interested in blood pressure or the other kind of care. Now they know how the blood pressure cuff works, how to take BP, how to take temperature, and in a few years, probably with good training, they will be able to help in emergencies also.
Okay, that's
So by
definitely encouraging.
themselves. So now they are taking orders and helping. Later on. Later on, they might be able to tell us the symptoms, tell us more, give us appropriate feedback, and even tell us whether somebody needs help, like
Needs awareness.
what kind of help somebody needs.
Because a typical feedback or a complaint which I hear from the industry people is they don't find people. They don't get caregivers, or even if they have, most of them don't have the mindset to uh, be a caregiver as such.
So that comes with maturity. So what happens is, this work, according to me, is a really difficult work to doesn't understand that somebody is caring for us, and there is always a question of dignity for the resident. So you'll have to maintain that dignity and also take appropriate care. So there is a very thin line in between, uh, like loss of dignity and to keep the dignity. So these people are really doing a fantastic job, whoever is working in this industry. But the problem is, their level of education doesn't allow them to understand the seriousness of all this work. And the other part is that even if they understand the seriousness, uh, sometimes these people do certain jobs because they have to do it rather than they want to do it. So when this industry develops, probably people will want to do the job. Like even before nursing was a job, certain people had to do. Now they want to do this job. So it has changed the overall perspective of the job now. So now this general duty assistant perspective is also changing. If you see, so many institutions are trying to train them. Now certifications are available. So probably after some time, like there's a nursing certificate, you will also have a GDA certificate, and people will be getting educated in this uh, overall course and learning the appropriate way to take care of a resident, take care of any patient for that matter. Because
So I think
training is going to be the centerpiece of all this. And not just training, revising it on a daily basis. So we have trainings, we have weekly trainings, we have weekly meetings. So all the issues are discussed. Sometimes they sometimes the dementia patient, a patient in delirium will say something that will offend the caregiver, and something that is not necessary probably, but explaining it to them was very difficult before, but now it is a little bit easier with education, that this person, this resident of ours, hasn't said a certain thing because he wanted to, he or she wanted to, but because he has no control over his thoughts. So if certain person is not educated, and will not be able to work. But now the workforce is a little bit different, and I have seen this difference in the last 4 or 5 years, definitely. So the overall spectrum is changing, and I know there's still going to be a problem because sudden leaves, and there's no notice period as such for them or anything like that. But those things will come when the job is established, definitely.
I think the sector is very highly unorganized at this point in time.
Mm.
So that makes a lot of difference. Once it is all protection of both the people who are hiring and the people who are getting hired. I feel for both there needs to be certain laws to protect their own interest, in that case.
Mm.
So coming to the next question that I feel after listening to you, we were talking about people moving into these facilities, nowadays that people are more enthusiastic and doing it by themselves. This change of, thought process, I would say, that is coming in, especially the Indian geriatric population, is not cannot be equal to somebody who is another 60-year-old. They may have totally different concerns. So, talking about it, what are the key concerns you feel that people come with when, especially, they are coming to an assisted living facility like yourself?
So the key concerns that they come with initially is that most of the times they have no one to look after, or no one to, depend upon. And at this point of time, many of them, so what happens is they are unable to do their own cooking. They're unable to do their normal household chores. They're unable to do their bankings and other things. Like whatever is easier for us, like we are doing at a single click, becomes a complex job for a person who is an elderly. So he's unable to manage calls, probably able to send messages or emails. That is at this moment, many of the people who are above 70, 75 are having. So even that is, according to me, a great bonus for us, that certain super senior is literally emailing or watching YouTube videos now, shorts, and sending it to me, sending different Facebook videos, making one and sending them to their grandchildren. So we have reached that literacy level of literacy, but still internet banking and rather than being a manager, they are happier to give the keys of all these things to us, because they have been doing this for their whole adult life. They have been taking care of whoever is dependent on them, and now they want to be free. So that is kind of one mindset. The other mindset is a lot of comorbidities, and now it is not physically possible for them to do all these concerns, and uh, some of them, uh, like I have seen in many places, some of them have they come with certain expectations, like want to stay for a shorter period of time just post surgery. They want to stay isolated. They want to just take rest and then go back to their life after 3 months or 6 months. So I've seen a different type of concerns from the patients. Uh, on the other hand, the caregivers have the similar concerns. So like take are being taken care of in the right manner is the only concern from their side. Otherwise, I think the elderly population is changing because the burden of labels that they had before is changing. Because
Correct.
before, like somebody who is 80 years old, if she is a woman, she has taken care of her in-laws, her family, like the younger family, if or he or she is alive or that way. So she has taken care of everybody, and now being in a place that is not her home is difficult for her initially, because she has been staying at home for 40, 50 years in the same home probably, uh, doing household chores, doing all those things for the people she loved, and now everybody is staying in some other country, and even a spouse is no more in this world. So what happens is there's a kind of different kind of isolation which we even in our imaginations will not be able to fathom that.
Very
Being
true.
depressed, there, if he or she comes to this place, if he or she likes it, adapts to this, then it is definitely a good opportunity at whatever we call movies nowadays, second innings or whatever. So, so she can have a second innings of life this way. Similar for even men. Men of, like nowadays, we cook, we clean, we do all kind of seen people go even in the kitchen. Men go in the kitchen, so they are like chronically dependent kind of human beings. So I think for them also it is a good opportunity here because they don't have to uh, think about whatever how they have to pass their day, how they have to do things the certain way or manage the overall scenario. So I think it is a good opportunity for everybody. The dynamics will definitely change. Uh, once you pass to another generation, the dynamics of elderly care will change.
That is true.
The things will change. Like generation to generation, the care will differ, but then the overall pattern will be same, and the safety, security, nutrition, and all those basic parts will be same. So, keeping the basics the same way and changing according to the diverse population and needs of the generations, that is going to be our challenge. And that is the main concern everybody comes with. I like this, will this be available? I like that, will this be available? And since the last 5 years, I have seen one change that before nobody asked for a Wi-Fi. Now everybody is asking for a Wi-Fi.
Wow.
First, when can you please connect my phone to the Wi-Fi? Can you please connect my laptop to the Wi-Fi? Is this TV smart? So, so they can watch their serials without ads. So whatever subscriptions, they have subscriptions of Hotstar and all that. They watch matches yeah, so they'll watch different matches and channel, if channel is not available, they'll be happy to switch to their smartphones or whatever cast, and they'll Chromecast or whatever, and they'll just start watching that. So it has changed in the last 5 years, and it will keep on changing that way. So
I guess by
concern,
the time we reach,
huh,
by the time we reach there, a
yeah,
lot of other changes would have happened. And
definitely.
I think both technology wise as well as the training side and the knowledge side. So
Hmm.
that's good. So, Doctor, I wanted to ask you one question from my particular side was, since you have been involved in this and you've seen the industry from a bird's eye view as well as from the inside, what the kind of a key recommendations in a nutshell you would suggest that we should, as a country, we should look at, as well as a society, we should look at? So anything which the central government can look at, the state government can look at, or as a entire society of working for the cause, we should look at.
So, main thing that I definitely would suggest is to understand the problem. So, we do not address or understand the problem till it goes above our head. Like it is beyond our control, then we try to control it, try to do certain things which probably would have been easier some years ago. So, we'll have to understand the problem and appreciate the problem. Like so many people like a certain person, a parent is happy that his or her son is leaving the country and going to some other country and staying there, or not staying with them, staying in certain different state, different city, far from them. Now the problem is that at the age of 75, that person who is staying abroad has a complete life available there. An elderly person is not able to adapt to the life outside of India because we, as a part of our society, are a very emotional society. We need and a very social one. Outside of India, it is very difficult to cope with that because most of the societies are practical and a little bit less emotional and work more on the principles of ease and convenience. So it is we have to understand the problem first, appreciate it. Second thing that we can do is we can have awareness programs regarding is going to go through all of this process. What happens is at the age of 40, people are not ready to accept that one day he or she is going to be an elderly, and he or she is going to face similar problems, and the acceptance that you are finally going to be dependent on someone or something is something nobody wants to think about. So if we are going to be mature as a society per se and in the form of like government steps towards it. So I think they have started with many other schemes, Ayushman Bharat and all others. They are including elderly. Even now, elderlies are going to be included in insurances. So that is in the pipeline. There are mm, there are other things that we see that there are advanced directives, advanced policy makings are they are working for the people. So in the awareness part, I think we are definitely going ahead and we are working in that manner. Uh, there is a certain kind of taboo in many of the societies that even in movies sometimes we are seeing that so many people are unhappy in care homes. But I think if you see the social activities and once they are with the peers of their own age group, so I think many of them happily will turn to these places rather than just like there are so many problems that I cannot even enlist today. There are so many issues, not just social, physical, clinical issues that the person faces. Just these are the things. So, and the other part is statistical analysis of the growing population. So, I think we should make infrastructure according to the statistical growth somewhere 15 to 20 years, keeping in mind all those 15 to 20 years ahead. So, for example, if the population is going to triple in 2050 or probably more than that, so we need to have such infrastructure and to invest or whoever is ready to make efforts in this regard should be encouraged and be it anything, be it any whatever the positives they are looking for.
So I think from
So,
the what you're saying is it has to be a total overhaul of the machine rather
hmm,
than just one particular part of the issue. Because
yes.
we have the infrastructure, we have the policies, we have the training, we have the
Hmm.
mindset, and then we have the incentives to do it. So I think yeah, I think it makes a lot of sense.
So, I mean, I agree to this. And I think looking at from the various perspectives, especially from a place of experience of assisted living, where people are coming, they want to be, a part of a system, whereas in socially also we are providing, you guys are providing with emotional support, with the social, spiritual, cultural support to them. Especially, I understand from Indian perspective, it's very important. So, and when we're talking about NRIs and the life abroad, yeah, it does sound interesting, and parents are very happy. Look, my kid is outside, but it's not practical at times for them to live. Not only because of the social structure, sometimes also due to the financial structures and the medical structure of it.
Hmm.
So, in most of these countries, the Western world we talk about, the medical infrastructure is extremely expensive
Hmm.
if you don't have insurances. That you gain after living in the country for 10 to 15 to 20 years. And if you don't have those kind of benefits to cover you up, the life can be really expensive. And not only expensive, very uncomfortable for basic things. And here I feel India, we're very blessed because thanks to the huge population that we have, we also have a huge amount of hospital infrastructure. We have amazing number of nurses. So I feel those facilities in other countries, for example, I was talking to somebody, a friend of mine in Canada, and this girl had a broken bone and she was a student who was there on the student's visa, of course, had the insurance. And through the insurance, it took her 6 hours just to meet a doctor who would say, yes, you have a broken bone, get an x-ray, and we will do the plaster casting on another day. So, and but in India, you reach the doctor and the process gets started. It's not like other countries. And we are paying pennies in that case in India. So that I also feel is a very plus point of an individual who has family abroad to be in a good assisted living facility in India, for that matter.
Yes,
So, coming to my last question to you, we have spoken about such beautiful things about how we can change the setup, the policies, the need of our the geriatric population, and everything. How can you explain to me personally that how have you felt that small things or very small intervention can make a huge difference in the quality of the life of the resident? I'm sure you have been doing a lot of changes around, where you are coming from. But how you felt like the smallest change that you made possibly and made a huge difference in the life of the other individual?
uh, so I had been working like during COVID-19. So I had been work going for home visits for elderly. So
Mhm.
one of my patients, they had a simple procedure. They wanted a debridement, but a surgeon was not available, or some admissions were not possible due to increased workload by COVID patients. So I, took some effort and had asked for a specialist to go to the his residence, and then we did the debridement. Like, it was not like patient needed at the moment, the hope he needed. And we did the smaller procedure there. After that, we had continued the nursing care. We continued his care for the next 6 months. His son was unable to come because he was in Australia, and at that moment, laws were very strict for Australia, that whether if you leave, even even interstate laws were very strict, so he was unable to come. We had somehow we tried and asked around and found out that he was able to come till Singapore. So we arranged, like, he wanted to meet his father and take him to Australia. So we somehow got his father on a flight from Bangalore to Singapore, and there he met his father, stayed in a hotel for some days probably. After the quarantine period, both of them went to Australia, and that person still calls me on Happy Doctor's Day, and says the same thing every year for the past 3 years, 3 to 4 years probably. But that is something I will remember all my life, because that is something more than clinical care that I had done. It is not something I had done. We had worked as a team with nurses, with other assisted facilities, like there are certain facilities who give logistic support, certain facilities who do the banking work and all that. So I worked with consulted different people, uh, consulted Google that which countries were available for Australian residents to come, and so I have done a thorough research. I had done a thorough research at that time, and made life a little bit better for one individual. Very happy I did that at that moment. Uh, I think he passed away uh, 1 or 2 years after that. He had he al- the Baba also had cancer, so he passed away naturally. But then, even if he got a single day with his son, or his son got a single moment with his father, this is something you might cherish for all your life. These moments, I think I get these moments once a week. I find something, I get something at least once a week that keeps me going and making me take some extra effort in my work, not just clinical, but in this overall holistic care of the patients.
Brilliant. I think it's so encouraging and so nice to hear things like these. And I think in this, to summarize the crux of the discussion, I think where we are coming from and what you are doing is the fuel for being in a sector like this is that emotional and a kind of a kind of a spiritual validation from your residents or your clients or your patients or whatever you want to call them, is that human response which they give you, not that fill up the form and give a feedback form. It is that human response when they get to you, that they remember you as a family. That okay, yes, here is someone who's actually done something which has changed my outlook or my life or my particular day or anything. So I think it's brilliant. It's like when someone cares. Idea is that amazing, amazing.
That is true, Pankaj. I feel the working in elder care, I mean, even after so many blessings every day, and that makes your life very fulfilling as an individual, I tell you. So personally, I feel it's a work full of blessings, and on the special day of 15th of August, that we are here sitting together. I would like to wish our not only our geriatric population but our nation a happy Independence Day. So from my side, Jai Hind.
Jai Hind, a very happy Independence Day to country, and we look forward for many such programs, and hopefully on the Republic Day we'll have something more bigger. Hey,
Sure.
doctor,
Sure.
Yeah.
thank
Sure.
you. Okay, right.
So
Bye.
Thank
much.
you.
Bye.
Thank you.
Okay. Bye.
Bye bye.